Hello. Thank you very much for your time. My name is Dr. Delali Hevi and I am a weight loss specialist in Arizona. I made this video at the request of some colleagues of mine in Ghana who wanted to know a little more about a revolutionary weight loss supplement that I recommend for all of my clients. So let's begin. Obesity has become the #1 cause of preventable death. This is because of the numerous illnesses and ailments that are directly associated with obesity. In 2013, the American Medical Association officially recognized obesity as a disease. This was hard for many people to believe, but when you gain an understanding of the pathophysiology of weight gain, it puts everything in perspective. The final common pathway to obesity involves the activation of genes and processes that cause fat deposition and the suppression of the genes that code for fat breakdown. Many different environmental factors can cause this gene regulation, and it is mediated through various hormones and cytokines. Unfortunately, any attempt at losing weight that does not address these cellular mechanisms is doomed to fail. I like to use the analogy of a fever. If a patient with malaria comes to you and you treat her only with paracetamol, what will happen? Even though the patient may feel good initially, the parasites will continue to multiply. The same applies for weight gain. If you target the symptoms alone using food restriction and exercise, it will work in the beginning, but eventually the patient's biology will resist those efforts and bring them back to their starting weight. What's worse is the fact that they will probably feel miserable, moody, and irritable throughout. This is the reason why 95% of people who go on a diet end up failing miserably. Because of this knowledge, virtually every obesity specialist in the USA will start their patients on some form of medicine or supplement right away. Now, there are many supplements to choose from, and some are unsafe because of the various chemicals, additives, and preservatives that are added to them. Some may not even contain any of the active ingredient. It can be very difficult to sift out the good from the bad. But by virtue of my knowledge in the field, my many years of personal experience, as well as the vast experience that the patients have brought to me, I have been able to narrow the medications down based on effectiveness and safety. What I recommend to all of my patients is Vida Lean. This is an all-natural supplement made from a fruit that grows in Asia and has actually been used in their cooking for centuries. The active ingredient was studied by researchers at Georgetown University in Washington, D.C., and they found that in just 2 months, the subjects dropped their body weight by 5.4%, increased fat burning by up to 109%, reduced bad cholesterol levels by 13%, increased HDL cholesterol by 9%, decreased hunger hormone levels by 38%, and increased serotonin by 45%. Vida Lean works at the level of the fat cell. It inhibits the enzyme citrate lyase, thus blocking the formation of fat from food and promoting the release of already stored fat. It actually targets the stubborn fat around the belly. Many of the patients who come to me have multiple comorbidities, and many of them are able to get off some or all of their medications. The only side effect I encounter with about 5% of the patients is mild nausea, which usually goes away in a few days. Diabetics and hypertensives have to be monitored because their numbers could drop. That may require a reduction in dosage or discontinuation of their medications. Vida Lean could take about 6 to 8 weeks to kick in fully and should be continued until the target weight is achieved. Many people ask me if they will have to be on Vida Lean permanently. Some patients experience a subjective shrinkage of their stomach after continued use for about 8 months. They therefore will not have to. Some patients, however, have gone so far into their metabolic derangement that they will need to be maintained on a low dose. In my opinion, it is a very good trade-off. Would you rather be on multiple medications that have a long list of side effects or on a single natural supplement that is proven to be safe? If you're able to take a hypertensive patient to target on medication, does it make sense to then turn around and stop that medication? The same principle applies in this case. I strongly recommend that you get your overweight and obese patients started on Vida Lean. They will be very pleased with the results and very pleased with you. Thank you very much.